So we'll start with one from you, John. Somebody asked, how can you get a test for gut health? You mentioned gut health might be important in IgA nephropathy. And so people are concerned that how will they know that their gut health, whether it's important or not?
So we know from studies that there are associations, but there isn't a test for gut health that is available. I think if you have symptoms related to your bowels, then you should see your GP. It is a minority of patients with IgA nephropathy that have an underlying disease of their bowel. And the vast majority of people who have diseases of their bowel do not have IgA nephropathy. So it is an association when we look at large populations of patients, but you certainly don't need to have bowel investigations if you have IgA nephropathy. And we don't have a specific test that allows us to monitor gut health. We are in fact going to do a study in Leicester. So look out on the Facebook page for a request for recruits, where we're going to look at using probiotics to see if that affects the way the gut behaves and the type of IgA that appears in the blood. But at the moment, it's an association that's pointing towards the gut being involved, but it's just an association at the moment. There's no reason to start thinking that you need your bowel investigated, is what I would say.
So just slightly linked to that so that we can cover all the gut questions. Somebody asked if there's any symptoms that you would expect for if the bowel is involved, and if you think there's a problem with the bowel, if you've got IgA nephropathy. Should people be looking for pain in there?
So IgA nephropathy is not associated with problems with the bowels. The disease that Louise is interested in, IgA vasculitis, can be associated with problems with the bowels, but that's usually quite obvious and is associated with the rash and other things. But in terms of general IgA nephropathy, there are no symptoms that we would expect to see with the bowel. If you do have symptoms, then it's important to see a GP, because you could just have two diseases at the same time, and we don't want to assume that any symptoms related to the bowel, you don't want to be putting those down to IgA nephropathy when they may be completely unrelated. So I don't routinely ask my patients for bowel symptoms if they have IgA nephropathy, but if they complain of bowel symptoms, then I will perform investigations in the appropriate way, looking for a range of different diseases.